Hi, Dave. How'd you do it?
You know, I'm not really sure. I don't remember any specific event. It wasn't like a big, fall or wasn't climbing out a ladder or anything.
Okay.
It was kind of a slow progression. It was about 5 months ago. I just started experiencing this pain in my shoulder.
Okay.
Kind of slow onset. It definitely started to get worse and worse as time went on. I didn't know what it was. I don't remember anything that caused it.
Okay.
Yeah, so I'm not sure what exactly went on there.
Did you try treatment before surgery? Injections, PT?
Yeah, I did. I did try PT.
Okay.
I went over there and did exercises and
Did that help at all?
I thought I was starting to, but we didn't really make much progress.
Okay.
So helpful a little bit, but my surgeon thought this might be the best route because it wasn't really going anywhere very fast.
Surgery was 2 days ago?
2 days ago, yeah.
How you holding up?
All right. I haven't really been able to do. He had me doing what are they called, pendulum things.
Okay.
I was supposed to be doing those, but honestly, it's just been too painful. I've been in a lot of pain.
Have you seen him since the surgery? Did you see you the day afterwards?
Yeah, right after, but I haven't seen him since then.
When do you go back to see him again?
It's going to be 4 weeks from now.
Okay. And then as far as kind of getting off of the anesthesia, did you have any sort of nausea, vomiting, any upset stomach?
No, I was fine with that.
Okay. Deal. He give you an idea as far as how long you're going to be off work?
He didn't really say.
Okay.
Honestly, at this point, it's been so long, I just want to take my time to get better and then go back.
Tell me more about your job. What do you do?
Well, I'm a truck driver.
Okay.
I deliver medical equipment up and down the East Coast, so I'm driving a lot, but I'm also required to lift a lot.
Okay.
I'm lifting equipment in and out of the truck, carrying it into different facilities. So it requires me to do a lot of heavy lifting, which I just couldn't do.
Okay. So you couldn't do your job prior to surgery?
No.
Okay. As far as you know, everything with the surgery went all right?
I hope so.
Okay. Fair enough. Is anyone at home to help you right now?
My wife is there, yeah.
Okay.
She helps me out, helping me get dressed and take care of myself.
What about sleep? It seems to be the worst usually after surgery.
Yeah, I haven't slept much the last couple of days.
Okay.
I think a lot of it's just the pain.
Okay.
It's been waking me up, keeping me up.
Are you in a recliner? Are you in a bed? How are you doing it?
Recliner.
Okay. So as you sit there right now, 0 is no pain, 10 puts you in the emergency room. How bad is your pain just sitting there?
Oh man, right here. Probably like 7
Okay.
out of 10.
Does it get, the last couple of days, has it been better than that?
Maybe 6.
Okay. Does it get worse than that? Or is it pretty constant?
No, it definitely gets worse. Like a 9, probably 9 is pretty bad.
Deal. Anything in particular that really bothers it? Certain motion, certain activity, anything?
Anytime I try to, if I accidentally move my shoulder, I bumped up, against the doorway the other day, and that didn't feel so good.
Okay. Coughing, sneezing, anything like that?
Yeah.
Okay.
I tend to be a quite aggressive sneezer, so that can be traumatic.
But deal. Doc said how long you want you in your sling? 4 weeks.
Yeah.
Okay. And then since surgery, have you had any sort of numbness, tingling, anything weird going down the arm?
No.
Okay. How's your elbow?
There's some pain in my elbow.
Okay.
Not sure why, but.
Okay. And what about your neck? Any issues with your neck since surgery?
Yeah, I kind of got, feels kind of tight and sore, more on the right side here.
Okay. Are you right-handed?
Yeah.
Okay.
Unfortunately.
Okay. Now, is your wife going to be able to be home to help you for an extended time, or does she have to go back to work herself?
No, she'll be able to be there to help me out.
And as far as dealing with the pain in the neck, the shoulder, the elbow, what are you doing? Are you taking medication for it? Are you using ice?
Yeah, Vicodin
Okay.
works to some extent.
Okay. Do you use ice or heat or anything?
I haven't been up to this point.
Okay.
I think I did right after I got home, but not consistently.
Deal. Does the Viking seem to help at all?
Yeah, no, it helps. If it's really bad and I take it, it'll take it down.
Okay.
But it doesn't necessarily ever take it all the way away.
Okay. And as far as your past medical history, is this your only shoulder surgery you've ever had?
Yeah, this is the only thing for the shoulder.
Okay. Any history of neck problems?
I was in a car accident a couple years ago, a little whiplash, but that was, I think, 3 years ago. And then
Okay.
minor rehab, healed up pretty nicely. I haven't had any issues since.
And at the time, it was just neck pain, not shoulder issues?
Right, it was just
Okay.
neck.
And no elbow or wrist, hand issues? Okay.
No, not on this side.
Other than that, any history of cancer?
Nope.
Heart disease?
Nope.
About high blood pressure?
Nope.
You're a pretty healthy guy. Any health issues that I should know about that I haven't asked about?
I don't think so. You can get it all.
Okay. And as far as kind of your activities around the house, how are you doing? I mean, bathing, any sort of grooming, how's that going?
It's pretty rough. My wife tends to help me out quite a bit.
Okay.
At this point, she'll help me get dressed and take a shower.
Mm-hmm.
I'm able to do a decent amount with this arm, but
Okay.
I've been amazed at how many activities require both arms, which is frustrating.
You are correct there. Okay. And when PT's all said and done, kind of what are your goals, or what do you want to get out of this?
I really want to get back to work.
Okay.
I want to be able to lift, the equipment I need to without pain, without feeling like the weak one.
Yeah.
And I think I'd like to get back to. I tend to run
Okay.
a little bit casually.
Good.
Not that I need a lot for the shoulder, but
Sure.
it was really I wasn't able to run once it started.
Okay.
I guess the movement of my body was really causing a lot of pain.
Sure. Okay. And then, did your doctor give you precautions? Did he tell you things that you're not supposed to do?
I can't really. I'm supposed to keep the sling on pretty much all the time.
Good. Have you been good about that?
Because of my wife, I have been. She keeps me in line.
It's a good thing.
It is.
Okay. Well, I think we're going to get you to the table. We're going to take your sling off and take a look and see how everything's healing and see how you're moving.
Okay. Sounds good.
So we want to take a look at the shoulder, see how things are healing, see how you're moving. We're going to have to get your sling off. Have you been able to take your sling off, or has your wife helped you so far?
She's helped me out.
Okay. We'll show you how. Go ahead and step off the table there. Okay. Basically, we're going to take off kind of your waist strap here first. Come around. Good. I'm going to take you out here. Now this arm can freely hang by your side. That's okay.
Okay.
So I'll hold you there. Good. Go on, let that drop down. Try and not shrug up there. Just relax. Okay. Alright. I'm just going to slowly let your elbow fall. You okay?
Yep.
Okay. It's okay at your side.
Okay.
Good. We're going to get this shirt off if you can. So, you got it?
I can get it, yeah. I've learned to do a lot of things with my left hand recently.
Good thing. Good. Easiest thing is probably just to lean over and you can grab it with that left hand.
Okay.
Good. Okay.
Yeah. Good.
We're actually going to get you up on the table here. I'm going to take your arm from you here. All I want you to do is just let it relax. I'm not going to surprise you.
Okay.
You're going to sit on the table. I'm going to have you spin around and put your head up on the pillow. Let it relax. Let it go. There you go. You're back.
Yep.
Good. You can rest. Take your shirt sleeve up here. Just want to get a look and see how the incisions are doing. Biggest thing we look for to see, is there any sort of drainage from it? Are they real red and swollen? You look fine, you really do. When you go back to have your stitches out? Another couple of weeks.
Yeah, I'm not sure. I think it was 3 weeks from the surgery date.
Okay, very good. Well, all I want to do is see what your shoulder movement's like. It's going to feel a little bit uncomfortable. It shouldn't hurt. I'm not going to surprise you at all. So
okay.
Just go ahead and relax your arm as best as you can. You okay?
Yeah.
Is that body up there?
Yeah.
Does it feel good to move it, or is it not?
It feels good until you get up there.
Fair enough.
Yeah.
Let her relax for me. We'll teach it for home, but some of this you're going to end up doing at home. Some of it we'll do here. We've learned that probably 30, 40 years ago, they would have left you in your sling for the first 4 or 6 weeks, and things didn't heal up quite as you would hope. And so early motion is a good thing, but you have to be careful with how much motion you actually get. So too much too soon can be a problem.
Okay.
Is that painful at all?
A little bit right there, yeah.
Good. Take it off. Feeling okay?
Yeah.
Not anxious at all?
No, I feel it right.
Okay. Relax this arm for me. I just want to see how far out you'll go.
Okay.
Is that painful there?
A little bit. Not too bad.
About as far as she's going today, and that's okay. That's really normal. Come and relax here. Did I get you there?
Mm-hmm.
Okay.
Yeah.
Okay. Relax the arm as best as you can. You okay there?
Yeah, that's not too bad.
Okay. And then cock your wrist back for me. Forward. Good. Relax. And just squeeze my fingers. Good. Relax. Your hands are frigid.
Yeah.
One thing you can do is we're going to have you start moving your elbow, but everything is going to be, so with your sling on, we'll teach you how.
Okay.
But your shoulder looks good.
Good.